We're here today to talk about one of the most significant health crises facing Americans. And we have a role at the National Spine Health Foundation to talk about this with the experts who are treating spine patients. And so today we're going to talk about a lot of different topics around managing pain for spine patients and the appropriate role for different types of medications, including opioid medications, for managing pain. So I'm going to start our conversation off with talking with Dr. Gum and Dr. Shuba about their experiences with their spine patients in this very difficult topic. And I think one of the things we'll talk about first is what makes this topic so difficult. Dr. Gum.
What's so difficult is the majority of spine surgeries we do actually inflict pain on patients. So it's a lot of them are invasive. We try very hard to do minimally invasive type procedures, but with that type of surgery, we inflict pain, and we need medications to help control that pain post-op. Opioids are a part of that; they're not the whole picture. So, what's difficult in our situation is we do these surgeries. They need some sort of medication or a combination of medications to help. But these medications can be very dangerous and lead to long-term consequences such as addiction or dependence. So that's a tough dilemma to be in with regards to spine surgery and opioids.
And first off, I'm just thankful you're bringing this up because this is such a big issue. And I think back to when smoking was cooler, whatever it was, and there were commercials, and everyone realized it caused lung cancer and heart disease. And we condemned that as a society. We realize all the preservatives that we have in food. We're realizing that causes diabetes and obesity. I don't think that people are realizing how pervasive this is, that basically every patient is 1 in 3 patients might have this effect. So as Dr. Gum said, patients are coming to us with pain, and as he said, it complicates it because sometimes the treatment exacerbates that pain. And so there's this catch-22 where we find patients saying, let's get you off narcotics before you have surgery altogether, but the reason they're coming for surgery might be because they have so much pain, so they're on narcotics. So what we have to do is we have to be creative, not only dealing with the person's own personal life, but also their personal surgical issues. So when we think of addiction or substance abuse, it's not just pain, it's also other aspects of their lives.
Right.
And so as surgeons, we have a unique position to see these patients in their family life, in their job life, in their function. And so in thinking about how to treat their pain, we also have to think about them as human beings. And if we don't, it's going to be the same issue that we saw with smoking and with obesity in this country. It's really going to affect everybody.